Welcome to the Passion Professors Podcast, hosted by Earth.University, where stories of life experiences and purpose inspire and unite humanity. Here's your host, Lindsay Andreotti.
Hey, everybody. This is Lindsay Andreotti with the Passion Professor Podcast. I'm so excited to hear you and see you today. And boy, do we have a guest who is going to be an amazing person with her passion around going from pharma to Dharma and how that relates to our health and healing. I have Joanna Carmichael. Hi, Joanna.
Hey, Lindsay. How are you?
I'm really good. And I'm so glad that you're with us today. Joanna is an amazing human being, everybody. She lives in Philadelphia or in Pennsylvania at the moment. You're probably not in Philly, are you?
Right outside.
Right outside. Okay, close enough. Yeah. That's how we met, was through a mutual friend of ours that lives in that area. And Joanna is just an incredible person who is focused on metaphysics and divinity while also being a registered nurse. And she carries this beautiful juxtaposition of the West and the East, and all of the things that go in between to help our bodies become healthy and healing. She's a practicing Ayurvedic and has been a yoga teacher, been doing meditation. She's an interfaith minister. I'm like reading all these things off of her list. I'm going, wow, Joanna, you do so much. It's incredible. And she's also been, yeah, right? I know, you're like, wait, do I do all that? She's been practicing in the nursing field for almost 30 years. And has also been doing pharmaceutical research for 20 years. And she completed a Vedic Mastery program under the inspired direction of Doctors Deepak Chopra and David Simon, and then went on to obtain a diploma in Ayurveda, which included an internship in Ayurvedic Medicine in India, which just, is so cool. The thing that I know about Joanna is that her heart is the size of Texas. She loves to watch people heal, and it's not just humans that she has passion around. So today, I welcome you, Joanna, so we can talk about going from pharma to Dharma for both humans and animals, and why this is important to our lives as people. So thanks for being here.
Oh, Lindsay, thanks for that introduction. Wow.
You're very welcome. You're amazing to me. I can't wait to hear more about all of this. So we're going to start off today's show by having you just kind of tell everybody a little bit about this background. You are a nurse, you've studied pharmacology, you've done research. I mean, tell us how you went from this knowing that we can be even better than what's out there now. So
what a great question, and we can be even better. All of us can. And my background's definitely unique and diverse.
Yes.
And nothing that I planned.
Always true. For those listening, it's always true.
We make plans and God laughs. That's really true. Yeah. And so, so I started out in nursing. I did psychiatric nursing for a couple of years and then got derailed into the pharmaceutical research arena. And that ended up being a very rewarding career for me. It totally renewed nursing for me, because once I graduated from nursing school, I thought, oh, there is no way I'm gonna be doing this for very long. Right. Although my interest was in psychiatry, and so I went right to that. And the mind and emotions was always a pull for me, but I was very, very unconscious at that time. So I went into pharmaceutical research, quite surprisingly, but it was really fascinating as a scientist, and I got to see the mind-body connection up close. And so I ended up starting my own company after about 4 years being in pharma, in companies. And simultaneously with that, when I was 26, I started studying metaphysics. And so it was, and there it was. Yeah. Something happens in your life, you're searching for answers, and, religion doesn't always answer that. So I started on this very intense spiritual journey, but it was quite a paradox, because people would say, well, how can you be a metaphysician and do drug research for a living? And I'm like, great question. I don't know.
It worked. Yeah.
But I ended up being passionate about both.
Yeah.
And the reason research was so wonderful for me is because I actually got to spend time with patients. Because as a study coordinator, especially when I started my company, there's well-meaning professionals in big pharma.
Yeah.
A lot of them, scientists, doctors, nurses, people that really do want to find cures. And when I started my company, it was to provide coordination services to doctors doing research.
Okay.
So clinical medicine and clinical research are two very different animals. In clinical research, there's a protocol you follow. There's a data collection tool. There's inclusion, exclusion criteria. You have to remove as many variables as possible.
Yeah.
So it's very different than clinical medicine, but and separate in that you got to spend a lot of time with patients. So it wasn't like, doctors being double and triple booked. It was like I got to spend an hour or two with these patients sometimes with blood draws, stress tests, Holter monitors, vital signs, all kinds of data collection. And so what was amazing about that is that as I'm studying metaphysics simultaneously, I'm seeing the mind-body connection up close and personal, because there's always a placebo run-in and a double-blind phase of the study, with the exception of, antibiotics and oncology, where there isn't, you can't use placebos. But in general, that's what it takes, 2 well-controlled, placebo-controlled trials to get a drug to the FDA. So what was fascinating is that when it was single blind and patients were getting a placebo in the run-in to ensure that they had that disease state that was, going to fit for the protocol, it would be amazing, because they'd be taken off of their, let's say, cardiac drugs and given a placebo, put on a treadmill, and you're waiting for values to change and to show that they had heart disease, to show that they had high blood pressure. And many times they'd screen fail out as they're walking on a treadmill going, these pills are terrific. And the doctor and I are going, okay, that's great.
Wow.
And the good news was that they could be off of many of their medications, sometimes all of them, or at least have them reduced. And the bad news for us is that they screen failed out because they didn't really qualify for the study. But in clinical medicine, you would never see that, because you would never take patients off of meds.
Right.
The drug companies want customers for life.
Yeah.
And doctors and nurses are taught to practice that way.
Right.
And so, a patient has a heart attack, let's say, they're treated, they come out of the hospital, they've had bypass or angioplasty, they're put on meds, and then all the follow-up visits, it's like, how are you doing? Fine, I'm doing fine. Let's keep you on all of that stuff. The conversation is never about, let's see if we can get you off of some of this stuff. Let's talk about diet. Let's talk about lifestyle. That's never the conversation. Yeah. But in a clinical trial with informed consent, I could see firsthand that they could be weaned off of some of these drugs.
Amazing.
And then in the double blind phase, that some of the patients are getting placebo. It's double blind. So at that point, the doctor and the nurse don't know. But that a quarter, half or a quarter of them are getting placebo, but they would all do very well. And so I got to thinking about how, isn't it interesting how the mind and the body work, and that just taking a pill will lower blood pressure, or will, even affect objective evidence, like on an EKG, during a stress test. So it was fascinating, not to mention that I got to spend time with these people. So I got to know their hearts. I got to know their grandchildren and their marriages and their jobs that they hated, and this and that. And the other thing, all things that contributed to heart disease are matters of the heart.
Yes.
And I did all therapeutic areas. I just did a lot of cardiology, but I did all therapeutic areas. And so it was fascinating to be studying metaphysics simultaneously with having this experience in clinical trials. And of course, as a nurse, you've been to doctors, we wanted people to do well. We wanted this drug to work.
Yeah.
So there was observer effect. There was all kinds of factors that went into it that, aren't really talked about too much.
That's really interesting. And so, when you looked at all of that data, right, you were seeing these patients feeling better and not necessarily having a pharmaceutical that made them better.
Right.
What were some of the things that you took away from that that then kind of led you down this path of, well, what are the ways, and you can pick on heart disease or anything else, but what are some of those things that we can be doing differently that will inspire better health and healing in us that doesn't have to do with drugs? What did you find along that path?
Well, first of all, it has to be a shift in mindset. You know, this whole quick fix philosophy of Western medicine, that's really got to go. The way medicine is practiced is just that: treat the symptom, not the cause.
Yeah.
And not looking at the whole person. You know, so a lot, cardiology again is a great example, because heart disease is about matters of the heart.
Yes.
People could be doing all the right things. I have clients now, they can be doing all the right things, but there's something there. There's a past trauma, there's forgiveness issues, there's no joy in their life. They hate their jobs. They hate their spouse. And all those things factor into it. Heart attacks, many of them occur 9 a.m. Monday morning because of that Sunday night phenomenon of dread of like, I can't wait to the weekend. And then Sunday night is like, I have to go to work tomorrow. That affects our heart. And people with clean coronary arteries with no blockages still have heart attacks.
Wow.
And so what needs to change is that, like, alternative medicine and lifestyle changes and diet, food as medicine, that's what Ayurveda is about, needs to be the first thing we talk about, not the last when the drugs work. It should be the first, because when you start to treat that and the little things that bother us, insomnia, a little fatigue, a little digestive disturbance, if you can treat it right then it doesn't snowball into a tumor on a lab report.
Right. Brilliant. And, this is one of the things for me, my passion is around supporting our next generation in getting this memo sooner. There were so many things that I wish I knew when I was in my 20s that I know now in my 50s. And, we can all say that, and that's I think there's without exception, people know that. But one of those areas is nutrition and the value of food and how it serves as a healing mechanism for us. And I want to go in that direction for a minute, because I know that's also going to lead to your protection of animals and what you see there. So talk a little bit to our next generation about what, if they could just get this right now, if you could just spend a little time thinking about, and then fill in the blank, what would you tell them to spend their time on?
Well, when we're young in our, teens, 20s and 30s, we're very, we think we're invincible. And, I had a lifestyle that was totally detrimental and totally took advantage of my body. Yeah. I was on airplanes, 4 to 6 airplanes a week sometimes, high pressure, high stress, drink a cup of coffee in the morning, not eat till dinner. It killed my adrenals. It, gave me chronic fatigue. It did all this stuff, but I was resilient and I could handle it, right. And then you get to your 40s and 50s and you're like, oh my God, what have I done? Now I'm trying to reverse it. So if getting young people to think in terms of, what can I do as prevention? Now, we're not usually thinking of our health when nothing is wrong. When we feel well, we're not thinking of it, but we have to think of it because without your health, there's nothing. You could have all the money in the world, and if you don't have good health to enjoy it, it doesn't really matter.
Do anything. Yeah.
Matter. So to start to think also in terms of holism.
Right.
It's like there's a great Ayurvedic proverb that I love, and it's when diet is wrong, medicine is of no use. When diet is correct, medicine is of no need.
I love that. When diet is wrong, medicine is of no use. That's beautiful. Our food should be feeding us well. That is correct. I love that.
Yeah, I love it too. And, in Ayurvedic medicine, which I'm very passionate about, just love Ayurveda as a nature-based philosophy where you're living in harmony with nature and all that is.
Yeah.
And so poor diet is the mother of all disease, and insomnia is the father. That's how we see things, because we're a society of insomniacs. We don't get enough rest. We're under a great deal of stress. And it's when we sleep and meditate and rest that the body gets a chance to heal. The body-mind, I should say. The body-mind gets a chance to heal. And so, that kind of takes us into our food, and our food should be our medicine. But the way our food is handled and manufactured and GMO'd and full of pesticides and chemtrails and animals injected with steroids and vaccines. So can we trust the food supply?
That's the question I have. I've really begun to question it lately. In particular, just I don't know. I want to grow my own garden for this purpose.
You should.
Well, awesome. And maybe we'll have another whole podcast on how to garden, because honestly, it's an important thing to have good, healthy food that you like and that you enjoy and that's good for your body. So I really appreciate hearing that. And, talk a little bit about what kinds of food is really good from an Ayurvedic perspective. How do we find our right kind of food?
Well, Ayurveda is primarily plant-based, plant-based medicine. But the beauty of Ayurveda is that we will use anything, including pharmaceuticals, if it's going to contribute to healing. So, and there could be times when you do need a pharmaceutical. Absolutely. Right. And this is not to bash Western medicine at all. It's actually to bring the two together. Because is a time and a place for it. The research and the studies and the drugs that we have absolutely have saved lives. Right. It's just that so much of chronic disease can be prevented. Yeah. When you start early, and even if you have something, you can still work on it through food and lifestyle. And so growing your own food is really key. And like in Ayurveda, fresh, local, organic as much as possible. But, even some of the organics things have been contaminated or aren't truly organic or kosher or whatever. So we really need to bring mindfulness and awareness about what's actually going on in these industries that are where there's interconnected corruption. Big pharma, the farm factory industry, and our food supply. Yeah. We should really be able to get all our nutrients from food, and we don't. I eat a very good, healthy diet, and I have to take supplements, and I can tell the difference when I don't take the supplements as to when I do, because the food just doesn't have what it should have in it. And so it's a challenge, and we're growing your own, getting a tower garden, that type of thing is really most important. You can, and hopefully, when you start to learn about what happens to these animals in factory farms, the abuse, the neglect, the horrific things that are done to them and then inhumanely slaughtered. I don't think humanely slaughtered and belongs in the same sentence, but you start to, with more awareness, you start to want to move away from those things because metaphysically we eat the energy of that. We're taking in that as prana, as life force. That's the life force that gives us life force. Right. And so you compare like an apple that's fallen off your tree in your own backyard, compare the prana and life force in that versus an apple that's been in storage for weeks and possibly months being shipped from another country. Right. There's not a lot of life force in that. No. Or compare that to an animal that's been tortured and slaughtered and has all the hormones of cortisol and adrenaline and fear and grief because they have emotions and they're seeing their buddies and their families get, tortured and abused and taken away from them. The calves in the dairy industry are taken away from the mothers right away so that we can have dairy. Yeah. It's not, and we're the only ones that do that. We're humans do that. Eat the milk, you drink the milk of other
mammals. Yeah, that is weird.
That awareness starts to infiltrate, and that then that becomes spiritual practice. Right. It's really it's more about understanding and deeply knowing, in your soul that we are all one and we are all connected, and that also means the animals and the earth.
Yeah.
So what we do to ourselves, we do to each other, and what we do to each other, we do to ourselves. And so that increased awareness just happens organically if you let it. And that you're like, oh, I don't want to, that is a cow on my plate, or a chicken that had life and emotions and a family, just like me.
Yeah.
And then you don't want to. And then it's not about deprivation or shaming anybody or bullying anybody if you should be vegetarian or anything. It's not about that. It's about ahimsa, or nonviolence.
Yeah, there you go. I really appreciate that so much, and having a perspective about the learning, so that once you know, then it makes it easier to make a choice. Once you can actually have an understanding of what's really happening, you can make a choice. I have one more thing I want to just get out here in the open is Joanna is going to be creating a holistic retreat center and animal sanctuary for the healing of animals and humans. And I want you to be sure, this is really, you are so lit up about this. And I think I want to hear more about that. And then I also invite our listeners, if there's anybody out there who's at all wanting or feeling like they're on a similar calling or path, to get in touch with you. So tell us about the healing center, your vision, and what you're doing.
Yeah, my vision is to have a place where people can come and, whether it's like a holistic bed and breakfast type of a situation, where they can come and just be nourished and nurtured and learn, and also interact with animals, because I know that on my own journey, and, a lot of the people that talk about our animal activists started out eating meat. We all pretty much did. Right. So it's not about judging anybody, and it's not about being self-righteous about anything. It's about the awareness of what's actually on your plate. And those of us that have gotten here, understand that, because we all ate meat and dairy and consumed all of that without thinking about where it actually came from. Yeah. And what I found personally, and what most people find, is that when they have an opportunity to interact with an animal, to pet a cow and to play with pigs, and to understand that turkeys are, have emotions, and chickens, love to be held and petted, just like your cat and dog. That's the game changer. Yeah. Because you look into their eyes and it's like, there's a soul in there, just like there is when I'm looking at you or myself in the mirror. There's a soul in there that wants everything I want: to be happy, to be nourished, to be loved, to have compassion and understanding. And so I don't, my vision isn't to have it on a huge scale, because we can't rescue them all. There's a lot of animal sanctuaries popping up, which I'm glad to see. But the ones that get rescued are the ambassadors for those who have no voice, which are millions. Yeah. They can't be rescued at all. So the best thing that we can do is educate people, and then decrease the demand, in the same way that we decrease the demand for Monsanto products and hit them in their pocketbooks where it's going to hurt. There's like 69 companies owned by Monsanto who have done terrible things to our food, to our land, to farmers. And I just don't buy or consume products made by that company. Yeah. And so the same goes for meat. And then I support companies that are nourishing and nurturing to the earth and to the planet in general. Humans and animals. So, that's a way to do it. So the retreat center is about, giving people an experience of what it's like to live sustainably and in harmony with nature, and have them learn to garden, to cook, learn about that there are choices in vegetarian and vegan living. There's loads of choices and ways to eat that are much more nourishing to our physiology, our mind, and our hearts, and that helps the collective, because when we help ourselves, we help the collective. Yeah.
We are so interconnected, everybody. If you haven't figured that one out by being part of Earth.University, this is what we came here for. This is a soul having an experience that is shared with 7.5 billion people, and I don't even know how many animals in all parts of nature. We're just one thing. Right. So if one of us is getting healthier, the rest of us are getting healthier. And it just it goes that way. So
that's right. And the best way to work on the planet is to work on yourself. Making these shifts and having these, moments of aha and enlightenment where you shift and then everything shifts. It's like, there's a lot of ancestral healing that even happens when we work on ourselves. We can heal our parents and our grandparents and the other generations and the ones going forward by working on ourselves. So it's always the best practice is to always be looking within. Yeah. And not you should, or, pointing your finger at somebody else and saying, my offerings are offerings. They're, suggestions and, and teaching people that the guru is within. Go with the inner guru, and that you don't need a medical degree to do that. You don't need any degree to do that, because you know your body, your mind, your heart, your soul, and tapping into that, is the most important. It's life purpose is your Dharma, what you're doing on your nourishing path. And so learning to do that for yourself does help others.
I love that. So, Joanna, how can people get in touch with you if they want to support this vision of your B&B, or even just hear more from you? You're a tremendous asset to those who are considering new paths of healing and eating and being well. So tell them how they can reach you.
They can reach me. My website is pharmatodharma.org. Okay. And the best way to reach me is through the website or Joanna Carmichael at me.com. That's my email address, Joanna Carmichael at me.com. Send me an email. I'm a transformational nurse coach, and it's very metaphysical and Ayurvedically targeted.
I love that so much. And we will have all of that in our description box below. So if you are watching, please feel free to get in touch with Joanna. She is a wealth of wisdom and knowledge in this arena, and is just a delight to work with. I think, Joanna, one last question. If you could do anything you wanted to from this day forward, and you just knew this was going to be the one thing you'd work on, what would you work on?
Within myself or in my vision?
Both.
Both. Within myself, just to deepen who I am, to continue to, about Ayurveda and metaphysics is that you can always go deeper. There's just no end, and it'll continue for lifetimes. Mm-hmm. So just to continue to deepen that connection with God and with all that is, and the animals and the planet and everyone here, and even interdimensionally. There's so much we don't know about what's going on in the cosmos.
Yes.
And I want to have some of those experiences. My Dharma here, it's really the animal sanctuary, and to get the word out to, I'm writing a book of the same title, Pharma to Dharma, really a nurse's journey from the dark side of medicine to the light. And, just to help with the awakening as much as I possibly can, because it is time to wake up. And the people that seem to be asleep or are buying into the narrative of the mainstream media, which is funded by big pharma and the farm animal industry and the food industry, to start to listen, to wake people up to search. Mm-hmm. To search for their own answers and to do research go down some rabbit holes and know that there's so much more out there. That's really what I want to see happen. Through my little portion of the earth, when I get my sanctuary that I can care for and be a steward to. But I also want to reach a lot of people through my book and my work in writing and lectures and things like that, to inspire people, not bully them, but inspire them to find their own Dharma. Mm-hmm. That's what it's about. At one time, pharma was my Dharma. It's just not now.
And that's really well said. There is a time where we realize, oh, hey, I did love this. And that was great. And it was my Dharma. And it shifts as we shift. And as we go within and we look and get the PhD in ourselves, we suddenly realize that there's more to this Dharma and to our mission in the world. And I love what you have to share. So thank you for being with us today, Joanna. You truly are a passion professor.
Thank you.
You're amazing. So everybody who's listening out there, we welcome you to Earth.University. This is your life and it's your path. You might as well get on it. We would love to hear from you. Please feel free to send your comments or suggestions or any ideas. If you loved this, please like and subscribe and tell everyone. We're wanting to really connect the world with people in their passion. And that's how we will evolve to the butterfly world. So thanks.
I love this concept of Earth.University because, that's another way we've been, brainwashed and manipulated is through, what education, should be. And it's not. It is about the earth. And
it's about the earth, and we live in our teachers. It's so good. Oh, wonderful. Well, thanks again, Joanna. And for everybody else out there, please go and enjoy your life and find your path.
Yes. Bye. Yay.